I'm Andre Huey, and this is the Skn Newsline Newscast. The government will not be extending the state of emergency despite the confirmation of the presence of the Omicron variant in the Federation, so says Attorney General Vincent Byron Jr. More in this Glenn Bart report.
The Skn COVID-19 related state of emergency will be lifted on the 31st December 2021, but the pandemic-related restrictions and regulations will remain, said Attorney General Vincent Byron. The Attorney General was making a presentation at the 30th December NEOC COVID-19 briefing when he stated that going forward, restrictions and regulations will be governed by the COVID-19 Prevention and Control Act. He explained what will occur as of the 1st January 2022, especially in relation to the entertainment industry.
On January the 1st, we will have new regulations, but these regulations would be based on the COVID-19 Prevention and Control Act. These regulations would be able to help to manage the entertainment industry, for instance. There would be no different from the regulations that have been proclaimed under the Emergency Powers Act. It allows entertainment events, as Superintendent Cromwell Henry has said, to be applied for via the Commission of Police. It allows for limiting the number of patrons, which is 75% of the capacity of the location, and the capacity of the location would then have to be managed where we allow one person to every 6 square feet. And when we have that number, it allows for 75%. That number should be posted on the walls of the entrance of the location.
Essentially, the Attorney General said it's about managing how people mingle at large events and in public spaces. Glenn Bart reporting for Skn Newsline.
Now that the Omicron variant is present in St. Kitts and Nevis, should we be alarmed? That is an issue we explored in this report.
While the Omicron variant of the coronavirus has so far proven to be milder than the Delta variant, the fact it is more contagious is concerning to medical doctor Cuthbert Sebastian. In his view, though the Omicron variant trigger milder symptoms, because it is more contagious, it could increase cases of hospitalization.
Even though it's less people getting sick, there's more people getting it, so it kind of balances out the amount of people that will go to the hospital more so.
Dr. Sebastian says he is more concerned about the vulnerable persons within the society who may have worse reactions to contracting the coronavirus than someone who is vaccinated or has a stronger immune system.
Even though it may not make as many people sick, it can transmit to, more vulnerable individuals who can get really sick a lot more easily than the other variants could have. So that's the main concern for me regarding this variant.
Dr. Sebastian believes residents will now have to take even more care to prevent contracting the virus. This includes, but not limited to, wearing surgical masks instead of the cloth masks most people tend to wear.
I think we should take all the precautions that we can individually and as a collective that we should. So preferably I would recommend people wear surgical masks instead of cloth masks. They have access to it just because it's just more protective than cloth. I would recommend social distancing. I know this is Christmas season. There's not a lot of social distancing. There's a few events going on. People are, happy to get back to normal and stuff like that. But we've never seen numbers like this increase this quickly previously. Hand sanitizing. Just even by walking around St. Kitts in town, I would see people without their masks. So clearly, we got to look comfortable. We can get back on the right track if we try.
Meanwhile, former Chief Medical Officer Dr. Patrick Martin reiterated that the Federation has a toolkit of robust measures to mitigate the spread of the Omicron variant, including sunlight, good ventilation, fresh food, bush tea, access to recreational areas, safe and effective vaccines, among others. Therefore, the Federation should continue to fare well in managing the levels of hospitalization and a very low case of fatality rate of less than 1%, Dr. Martin said. Andre Huey, Skn Newsline.
When we come back, King Astro is Calypso monarch again.
Get in on the biggest sale this Christmas at Smart Electronics and Island Electronics. For the entire month of December and January, get huge discounts store-wide. Only at Smart Electronics and Island Electronics for the finest in electronics, gadgets and appliances in the best brands. COVID protocols will be observed. Visit Smart Electronics at Portzante or Island Electronics on 4th Street. Two stores, one great experience.
"2021 has been a challenging year.
But through it all, we weathered the storm and we are still here.
So as we close the year and look towards 2022,
We want to thank you for staying with us as we kept you abreast with the happenings around us.
As we spread Christmas cheer and love this season,
From all of us here at Skn Newsline and Voice of the Caribbean Radio.
season's greetings and a prosperous 2022.
On behalf of the staff and management of Smart Electronics, we want to wish you a Merry Christmas and a Happy New Year. Merry Christmas!
Welcome back. King Astro delivered a third victory as Calypso monarch, winning the 2021 Sugar Mass Calypso competition on Thursday night. Glenn Bart reports.
Calypso veteran Oscar Brown, King Astro, dethroned reigning monarch Queenie G at the 2021-2022 Sugar Mass 50 Senior Calypso Finals held at Carnival Village in Bastille. King Astro racked up a total of 710 points with his renditions Resilience and Pay to Live. Winning the title for the third time, Astro emerged winner from 7 other finalists, with King Socrates, a 6-time crowned monarch, taking first runner-up position with 698 points. Second runner-up was secured by Lady Diva with 696 points. The other finalists were defending monarch Queenie G, as well as Queen Kibby, Murray, King Hollywood, and Takeover. The 30th December National Bank-sponsored Calypso Finals had a guest performance from King Entertainer, the first national senior Calypso monarch who won the crown in 1971 and in 1972. Glenn Bart reporting for Skn Newsline.
With the Omicron variant triggering an upsurge in COVID-19 cases worldwide, the impact on tourism is inevitable. How will that impact St. Kitts and Nevis as the Federation looks to revive its tourism sector? We explored that issue in this report.
The Centers for Disease Control and Prevention has issued a travel advisory warning U.S. residents to avoid cruise travel as the COVID-19 Omicron variant continues to spread rapidly across the country. On Thursday, the CDC updated its guidance for cruise ship travel, moving from a level 3 to a level 4 warning, the highest threat level. The CDC previously advised that those who are unvaccinated should avoid cruise and river travel, but now says all residents, even those who are fully vaccinated, should avoid cruises. This news will impact cruise tourism and, by extension, tourism in general in St. Kitts and Nevis, says former Tourism Minister Dwyer Astafan.
Well, it will have an impact. The question is how deeply and how widely this impact will be. We have suffered tremendously over the last going on 2 years, and this will extend it. Fortunately, the science is telling us that the Omicron is not as deadly, but unfortunately it is even more contagious. So while it may cause less casualties, and we hope that it causes none, it could put people out of work. When it's out of work, make them sick for a while. And in the meantime, speaking of out of work, if businesses are going to lose opportunities as a result of the Omicron, not just locally, but globally, then you might start to see some downsizing again.
Mr. Astafan believes the emergence of the Omicron variant will also put a dent in the hopes of economic growth as projected in the 2022 fiscal budget of the government.
And it will certainly have an impact on planning, because you would have heard the budget issued last week, and the budget was filled with hope and looking at a potential 11-12% growth in the economy, largely driven by tourism. And the Omicron may put a dent in those hopes. Sad to say, but it's something we have to be very watchful with.
The Omicron variant of the coronavirus is said to be more contagious than the Delta variant, and while symptoms are milder, health experts are concerned about possible increases in hospitalizations. The Ministry of Tourism on St. Kitts will be hosting a press conference next week Friday to provide updates on cruise tourism. Andre Huey, Skn Newsline.
When we come back, we take a look at regional news.
Online radio has never been this great. It's Voice of the Caribbean Radio at voiceofthecaribbean.net. Tune into Voice of the Caribbean Radio for great Caribbean programs, news, entertainment, sports, and current affairs. Wake up each morning and be inspired with One Day at a Time with Kim Huey. Stay abreast with news across the Caribbean and internationally with the Caribbean News Hour, and be entertained with shows like Reggaeville, Caribbean Classics, and Jive Music Show. Visit our website, download our Android mobile app, or listen us on TuneIn Radio. There is so much more on Voice of the Caribbean Radio, reaching the Caribbean and beyond. Check website or app for program schedule.
Are you ready to create high-performing TV commercials?
Ready.
Ready. Ready. Create and tell compelling stories. Reach your target audience. And build brand awareness. Our strategies and execution will provide for your desired outcome and clearly represent your brand. Visit us at www.madebyopen.com and get started on your creative video commercial today. Lights, camera, Open Interactive.
Auto Plus Car Wash, located on the College Street Gut, Bastyr, St. Kitts. Bring your car to Auto Plus Car Wash to remove water stains, wiper marks. Get your doors, roof panel cleaned, seat floor mats, buffing, headlights, and engine wash. You get quality service at the best price at Auto Plus Car Wash. They really care for your car. Call 765-5140 or visit them on the College Street Gut, Bastyr, St. Kitts. Auto Plus Car Wash, where the service is number one.
Welcome back. It has been a challenging year for CARICOM, says Prime Minister of Antigua and Barbuda, Gaston Brown, who is also the chairman of the regional grouping. More in this report from ABS TV.
Prime Minister Brown recounted the immense challenges which have tested the mettle of the regional integration project in 2021. The CARICOM chairman empathized with the plight of the only French-speaking member state, Haiti, following what he called the abhorrent and reprehensible killing of its president, Jovenel Moïse. He said Haiti was also rocked by an earthquake which claimed more than 2,000 lives and caused extensive infrastructural damage. Another major natural disaster occurred with the eruption of the La Soufrière volcano on St. Vincent and the Grenadines. Prime Minister Brown also outlined the strides made in the region's response to the COVID-19 pandemic, such as the sharing of highly appreciated donated vaccines from the government of India. He also highlighted the persistence of heads of government which eventually secured supplies from the United States and the engagement of the African Medical Supplies Platform for vaccines at discounted costs. The outgoing chairman also noted the past year saw the strengthening of diplomatic relations with Africa at the historic first ever CARICOM Africa Summit. It has also been a landmark year for the regional bloc as Dr. Carla Barnett, a national of Belize, became the first woman to become the Secretary General of CARICOM. Prime Minister Brown also highlighted the contributions of stalwarts Celeste Bryant-Byrd and Sir James Mitchell, whom the region lost in the past year. He credited both regional icons with moving the integration process of CARICOM forward. Terry Andrew, ABS News.
Research done by the Northern Caribbean University in Jamaica shows that majority of Jamaicans do not trust the government's vaccine rollout program, leading to vaccine hesitancy. TVJ News reports.
A new research has revealed most Jamaicans do not trust the motive behind the government's vaccination drive, causing continued low take-up. The research was conducted by the Northern Caribbean University. O'Shane Masters tells us more.
A target of 65% vaccination by March 2022 is in jeopardy as fewer Jamaicans are going for the jab locally. Only about 19% of Jamaicans have been vaccinated against COVID-19. But why is that? Director of Institutional Research at Northern Caribbean University, NCU, Paul Bourne, says that has to do with trust.
We are seeing that only 19.3% of Jamaicans trust the government, and many persons do not. Many persons think that there's a sinister motive behind the vaccination. So if they do not trust the government and they think that the campaign has some other plan or some other thing to do with it, then what is happening is that they are going to be reluctant to be vaccinated.
Mr. Bourne says, based on the research from his team, approximately 64% of Jamaicans believe that there is an ulterior motive behind the vaccine initiative. Based on that fact, he says the government should not be the ones leading the charge.
Because 7 out of every 10 Jamaicans say that they will be vaccinated if they think the vaccination is working or if they think the scientists are coming out and actually letting them be told what the vaccination is all about. So the doctors, the epidemiologists, the virologists are the persons who should be taking the charge as against the Minister of Health and the Prime Minister and other government members relating to the vaccination.
There were also concerns that the vaccines were being forced on Jamaicans. Mr. Bourne says 55% of the respondents believe they were being forced to be inoculated. He says if that messaging continues, it could be detrimental to the goal of receiving herd immunity through vaccination. He is also calling for a revision of any policy to institute mandatory vaccination. 1
in every 4 Jamaicans at the moment is vaccinated, which means that 3 in every 4 is not vaccinated. So if you're going to use a mandatory vaccination and persons think that there is a motive behind what you're doing, then what you're going to be having is chaos if we were to have any other outbreak of this virus happening in Jamaica, because people do not trust you. They think that there's a motive behind what you're doing. They think the campaign has some other reason behind it. So what we are doing, we are alienating the people. So if we were to use mandatory vaccination, or people think that you're enforced to be vaccinated, then what we're going to be having is most Jamaicans looking in to be vaccinated and won't be vaccinated, even though they think it's important.
The research, titled Jamaicans' Decisions on COVID-19 Vaccination, a national cross-sectional empirical survey, had a sample size of 1,074 respondents across the 14 parishes in Jamaica. It has a margin of error of 5%. O'Shane Masters, TVJ News.
Now to news on the international scene. Despite very high vaccination rates in South America, public health officials there are battling vaccine misinformation from the highest levels of government amid concerns the vaccines used in the region may not work against COVID-19 strains. NBC News' Priscilla Thompson reports.
South America,
where at one point mass graves stretched farther than the eye could see, a reminder of COVID-19's deadly toll, is now emerging as a frontrunner in the race to vaccinate.
South America is the region with the highest vaccination rates.
Some parts of the continent now surpassing Europe and North America in inoculations. In Chile, a whopping 87% of the population is fully vaccinated. Italy and France are both at 74%, with the United States at roughly 62%. In all, South America has more than 63% of its population fully vaccinated.
South America has taken off with its vaccination. Brazil is an excellent example of how vaccination, once supply chains were secured, rolled them out very quickly and now have higher rates of vaccine coverage than places like the United States.
But in Brazil, where more than 600,000 have died from the virus, public health officials are also battling skepticism and misinformation from those in power. President Jair Bolsonaro has yet to get vaccinated and continues to publicly criticize the efficacy and regulation of vaccines.
Efeito colateral, problema qualquer, já sabe que não vão cobrar de mim.
But officials are now bracing for yet another problem.
The worst case scenario is a real substantial hit to our vaccine efficacy.
Many of the South American countries use non-mRNA vaccines like Sinovac and AstraZeneca early on in their vaccination efforts. Now, scientists say people who receive those vaccines could be vulnerable as new variants emerge.
Those vaccines did their job. Problem now is that those vaccines may be ineffective against Omicron.
Even if the region is successful in boosting its population against Omicron, the devastating impacts of the years-long pandemic won't be easily overcome. The pandemic has worsened already dire conditions in countries like Honduras, Guatemala, and Venezuela. A new report by the United Nations finds hunger in Latin America and the Caribbean is at its highest in 2 decades, affecting more than 59 million people.
What is important is to prioritize the most vulnerable groups. They had more difficulty to access healthy foods than before the pandemic. And that's mostly because they don't have enough money to buy the foods and also the fear of getting COVID.
Fear that health experts in South America and the rest of the world say can be eliminated by getting vaccinated.
What we need to do is to invest heavily in boosters, and boosters not just for the industrialized wealthy countries such as in Europe or United States, but also for regions in South America. I think that there's an important lesson learned that with good public health interventions, you can protect your regions.
And Priscilla Thompson joins us now. You know, Priscilla, it really seems inevitable that variants like Omicron are going to reach these countries. How are they getting ready? How are they preparing for that?
Well, Aaron, on one hand, these countries have pretty robust vaccination systems that people trust because of the infectious disease outbreaks they've had to deal with in the past several decades. But on the other hand, there is the question of the effectiveness of these non-mRNA vaccines against the Omicron variant. And that's something that researchers in these countries, in this region, are working to determine whether they should be telling officials to stock up on those mRNA vaccines, and that when people get boosted, they get boosted with those vaccines in order to offer that extra protection. Aaron?
All right, Priscilla Thompson for us tonight. Priscilla, thank you.
South Africans are describing the late Archbishop Desmond Tutu as an irreplaceable, fearless leader. Africa News has more.
South Africans are describing the late Archbishop Desmond Tutu as an irreplaceable, fearless leader. Delivering the annual Desmond Tutu lecture at the University of the Western Cape in 2011, Archbishop Desmond Tutu strongly criticized South Africa's former President Jacob Zuma for promoting his own interests. Tutu did not shy away from slamming former President Thabo Mbeki's administration on delaying the introduction of an HIV/AIDS drug treatment plan. Former local politician Olile Ncamama says Tutu's fearlessness made him a great leader.
Desmond Tutu, kwa government ukhona, he criticized the president Mbeki, yabo, ngendaba ye-HIV/AIDS, yabo, Mbeki wayengafuna ukukhupha the ARVs sithi enanto ethethayo ngalento HIV/AIDS. So Desmond Tutu wamcriticize kakhulu, you know. Again, president lo besando baphuma khona president uZuma bengayithandi lanto le corruption bisanzeka.
Tutu's leadership role expanded beyond the church. He helped lead the movement that ended the brutal regime of white minority rule in South Africa. Taxi driver Bonisile Sifuba says the country does not have leaders in Tutu's caliber.
Sibuhlungu singumzansi Afrika ngoba ke utata lo uwileyo ngoku ushiye inxeba elikhulu ukuthi ngoba ke simazi kakhulu ngendumasi yakhe ebengusihlalo weCommission waphinda wanqenqa phambi kwebulldozer izawudiliza amangcwaba so zizinto ezinkulu ezo azenzileyo engumuntu.
Behind me is the City Hall in East London where the Truth and Reconciliation Commission took place in the late 1990s. This is also where Archbishop Desmond Tutu broke down in tears in hearing the atrocities of apartheid. South Africans in this particular city say they will remember Tutu's role in bringing about justice and fighting corruption. Wandi Swantengendo, East London, South Africa, Africa News.
In sports, some of the Jamaican players in the national football team may not make it to Canada for their World Cup qualifier next year as they are unvaccinated. More in this report from TVJ Sports.
And welcome back. Second half action now. Jamaica could be without several players for their return World Cup fixture against Canada next year. That's because there are a number of players who are yet to be vaccinated. More in this report. Even though spectators must be vaccinated to see the Reggae Boys play at the National Stadium, there are a number of players who are yet to take the jab. But those who are yet to roll up their sleeves will miss out on the trip to Canada, who are asking that all travelers must be vaccinated before entering the country.
We are very much aware of that, and the players have been told of the requirement for them to participate in the game of Canada. So they do have a choice. You're giving up certain privilege. You're not forced to, but it is for you to make a conscious decision based upon the privilege that is afforded to vaccinated persons.
This then begs the question as to why overseas-based players are not vaccinated and local-based players are mandated to do so if they are to play in the Premier League. A similar stance, but a different outcome.
If you choose not to play in the National Premier League, you can play somewhere else where the rule is a lot more relaxed. The National Premier League is not the only way you can play football. If he's good enough, he will get a contract somewhere else. If he's good enough to play for the national team, he is good enough to play somewhere else other than in our Premier League.
According to JFF General Secretary Dalton Bent, they are not worried about losing players who refuse to be vaccinated, as a consultancy was done with the clubs before making the mandatory steps.
And our consultation has come up with the fact that persons are willing to get themselves vaccinated to participate. The majority of players now are vaccinated, or if they are not, they are willing to get themselves vaccinated.
Wint is also aware that although the JFF and the PFJL are trying to cut costs on COVID testing, it's an area that cannot be neglected, as even the vaccinated can still catch and spread the virus.
Welcome to the Skn Newsline Weather Report. I am Janil Bull. Here is a look at the 4-day forecast for St. Kitts and Nevis. For a more detailed weather report, visit our website at www.sknnewsline.com.
You have been watching the Skn Newsline Newscast. From all of us here at Skn Newsline and Channel 95, we want to wish you a happy and prosperous 2022. We thank you for your support over the past year in 2021, and we look forward to bigger and better things in 2022. We want to thank all our advertisers on the newscast who have supported us over the past year, and we look forward to working with you and others in the coming year. So again, on behalf of us here at Skn Newsline and Channel 95, we wish you a happy 2022. Thank you for watching, and do have yourself a wonderful holiday. I'm Andre Huey.
2021 has been a challenging year.
But through it all, we weathered the storm and we are still here.
So as we close the year and look towards 2022,
we want to thank you for staying with us as we kept you abreast with the happenings around us.
As we spread Christmas cheer and love this season.
From all of us here at Skn Newsline and Voice of the Caribbean Radio.
Season's greetings and a prosperous 2022.